Welcome to COVID Talks. I have the pleasure to have with me Professor Caline Mattar. Dr. Mattar is an infectious disease specialist at the Washington School of Medicine in St. Louis, Missouri. Welcome, Dr. Mattar.
Thank you, Dr. Klober. It's a pleasure to be here with you.
Dr. Mattar, you have served several times for the World Medical Association as an advisor, and today what we would like to do is to speak about face masks. Now, traditionally, there are different types of face masks that are being used in the clinic in medical professional use. The very traditional is the surgical face mask that has been used to keep the operation room free from droplets that come from those in the room, not to be spilled into the wound or not to be spilled in the operation field. There are other face masks which are to protect the wearer, specialized face masks. We have heard about them. Could you give us a little bit the difference between the surgical face mask and the more specialized face masks that are being used?
Absolutely. So sometimes surgical masks are also in some countries called medical masks, and it is what people think of when they see somebody with a mask in a doctor's office or a nurse, etc. And those masks are indeed, as you mentioned, very important to protect surgical fields, to protect the other from big droplets that we may cough, etc., from bacteria in the mouth, but also viruses. So those have been used for very many years, and we know that they're actually quite effective at protecting the other, but also more recently, not just during the COVID pandemic, but even before that, we have been using those to protect the individual in a hospital, for example, from respiratory infections that can be transmitted via droplets. So some examples of that would be influenza, for example, respiratory syncytial virus, parainfluenza, and so on and so forth. So for those, if you have somebody that's infected with, let's say, influenza in the hospital, and you have people caring for them, a surgical mask or a medical mask would be effective to protect the healthcare professional from getting infected from the respiratory secretions, cough, etc., from the patient as well. So those would be important instances where that mask is protective to the individual themselves as well. Having said that, we're hearing a lot now in the media, etc., about the specialized masks that you mentioned, such as respirators. Some are called N95, FFP2, FFP3, and those are, as you mentioned, very specialized type of masks that have different kinds of filtration. And the filtration in those is for very, very small particles. And this is where we think of what we call an airborne transmission. So basically, organisms, bacteria, viruses, etc., that transmit via a very, very small particle size. Examples of those that we know very well are tuberculosis, for example. So those types of masks actually filter the aerosols, so the really small particles, infectious particles, from reaching the person wearing the mask, so the healthcare professional. So those masks are actually very, very useful and necessary for infections where we think they are transmitted via aerosols or airborne modes of transmission. So those examples of those, as I mentioned, classic would be tuberculosis. But during the COVID pandemic, we have come to realize that the virus can potentially aerosolize, so can potentially produce really small particles that can infect the individual in very specific occasions. So during specific procedures where the healthcare professional is doing something to the respiratory tract, be it lower down the lungs or the upper respiratory tract, etc., there is a possibility of such a transmission when certain types of procedures that we call aerosol generating procedures are performed. Then people within 6 feet, or within the international guidance is a meter, so less than a meter from the patient, are certainly at risk for this kind of transmission. So in those cases, the N95 the respirators, FFP2, etc., would be protective for the healthcare professional performing those procedures and the people who are in the immediate surroundings assisting, etc.
Within the COVID-19 pandemic, these face masks are also recommended or actually demanded to be worn in public places, especially in congested rooms like public transport, in shops, and other gatherings which are necessary. Do they protect in these normal circumstances as well?
So when we are talking about cloth masks or face masks that people in the community are wearing, you can hear certainly several opinions. What we do know so far from the science is that those types of cloth masks are good at protecting the other. So for example, if I am sick or if I have the virus, potentially COVID-19, and I do not have any symptoms, wearing that mask would prevent me from infecting somebody else. And the percentage protection is variable from one study to the other. Important things to remember to make that mask more effective is to make sure that the mask fits on the face tightly. The other thing is the masks that are made of two different types of cloth. So what we call them hybrid. So for example, cotton and something else, those tend to be more protective. There are studies also that have shown that these types of masks can be up to 60% protective for the person wearing them. So there's definitely a protection for the other. And if the mask is well-fitting, is of good quality, that can also protect up to 60% the person wearing the mask.
In order to be protective, the mask has to be used properly. And that means it also has to fit tightly to the face, and it has to be worn in a certain way. Is that correct?
Important thing when we're thinking about putting on and putting off the mask is first to do hand hygiene very well, washing hands, soap and water or alcohol, because whenever we're putting on or taking off the mask, we can touch our face accidentally. That is one way we can actually self-infect. The mask would be taken and put behind the ears and making sure that it fits tightly, covering the nose and the mouth. Another thing that is important to remember, the same thing when we're taking off the mask, is we would want to do hand hygiene first, remove the mask from behind the ears. And actually that mask shouldn't be left on a surface, shouldn't be left on the table, but rather if it is a cloth mask, it should be washed either with soap and water. Usually washing machines, depending on the cycle, would be okay. Drying it at a very high temperature may destroy the mask and may decrease its filtration ability. So usually the easiest and safest way is to actually hand wash the mask with soap and water. It's important to remember also that face masks in general for the public can also be those same types of medical masks. They tend to be available as well. In those cases, if they are available, we would recommend is that that's a mask that should not be washed, should not be wet. If it is washed or wet, then that mask is not good anymore and should be discarded.
The face masks, as you said, don't give 100% safety. It does not replace, and that is important, other measures of hygiene. You mentioned hand washing, but it certainly also does not replace the distancing that we have to do.
Absolutely. Some other measures to ensure that somebody is protected 100%, because we did mention that the mask is protective to up to 60% potentially, is physical distancing. So physical distancing would be maintaining a distance of 1.5 meters or above. In some countries, the recommendation differ to 2 meters and above, but making sure that there is that physical distance between individuals to make sure that transmission and infection is decreased as effectively as possible. Adding to that, the hand hygiene, so very good hand hygiene and avoiding touching the face.
We have been speaking about the droplets and about the aerosols. Now, it is very obvious the droplets fall down to earth very rapidly because they are big enough and will not be moved by the air. But the aerosols are a little bit more complicated because they can stay in the air. So what can we do to avoid a large accumulation of aerosols in the air?
That is a very good question. If we are talking in the community, the safest way to avoid aerosol accumulation is to try to be in open air spaces and to avoid crowding in enclosed spaces, because this is where the aerosols really have nowhere to go and they tend to sit in the air for a prolonged period of time. Having said that, when we are talking about a healthcare setting, this is a more complicated discussion. If we know that aerosols may stay up in the air for a certain number of hours after, for example, an infected patient was in that room getting a procedure, etc. So specific measures should be taken, particularly to protect the cleaning staff, the environmental services staff who are going to clean that room, but also anybody entering this room to make sure that they are in full PPE, personal protective equipment, including masking, etc. Because, as you say, those aerosols can certainly last and stay in the air longer than what would we expect. So having said that, it means that when we take the patient out of the room, it does not mean that the aerosols are gone. One other effective measure that would be coupled with the respirators, with the N95s, the FFP masks that we mentioned when we're talking about healthcare settings, would be negative pressure ventilation. So that is coupled with the appropriate PPE would be the most protective for the healthcare professionals and any staff that are in that specific room.
Another measure that has been proposed is to use face shields, plexiglass face shields which are covering the whole face. Are they a complete substitute for face masks?
That's a very, very good question. And potentially that may be stemming from the recommendation that healthcare professionals should be wearing those face shields when caring for patients. And the face shields actually protects from droplets and particles in the immediate. So for example, if I am wearing a face shield and you are the patient or the person in front of me and you cough in the immediate, this protects me, protects my mucous membranes very effectively in the immediate. 15 minutes and later, we start seeing that protection completely weans off. Up to an hour, there's really no difference between putting a mask, putting a face shield, or no face shield at all. So what I am trying to say is that the mask is an absolute necessity. The face shield would add some protection, but they are definitely not equal, and it's not a substitute to having a mask.
Thank you very much, Caline.
Thank you.